Everyone makes mistakes. I have failures, right? I'm not immune to a failure. The important thing is being able to manage the failure and then learn from it, but also remember that you are still treating a human being.
So somebody listening to this, if a doctor's like, okay, I want to get into full arch, or I'm just getting into full arch, what are some things that they can do that way they can avoid these problems, right? Like the work you're doing is far more complicated and has way bigger consequences.
Yeah, so I think the proper continuum of any surgery, obviously I come from a residency background and telling everyone to do a 4-year residency. If you're going to start learning more complex things, it's just take the time and do the education right. A lot of people tend to be self-taught these days with the internet.
Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. And today I have a special guest, Dr. Alex Nguyen, who's an oral surgeon, and he's going to explain how redos, meaning the people out there that are messing up on their full arch cases, are where most of his business is coming from. And he's going to tell you how to avoid falling into that trap, how to avoid falling into having to redo your arches. And then he's also going to tell you how to pick a mentor. This was super, super valuable. I really, really appreciate Dr. Alex. He didn't have any financial incentive to come on this podcast today. He just did it to share his journey. And I promise you, it's going to be very, very impactful. Stay tuned. All right, we are live, and I'm excited about today's conversation because I get to talk to awesome people and I get to learn from them. So today we got Dr. Alex with us, and I'm excited to learn from him. It's so funny. We were just having a conversation about marketing and operations and clinical when it comes to full arch, and I told him, I said, you know what? To be honest with you, for most dentists, marketing's like maybe 5% of the problem when it comes to full arch, and then 95% of everything else. But a lot of dentists think that marketing's like 95% of the problem once they learn clinical, and then 5% everything else. And I really think it's the opposite way around. So Dr. Alex, thanks so much for coming on today. It's really a pleasure to talk to you and learn from you. So why don't you tell us what the number one thing that you see that's helping dentists grow their full arch cases?
Yeah, thanks for having me on, Gary. In full arch, I feel like there's a few different ways people want to grow. And what I'm seeing, I think more common is high volume, lower cost. I think that might not be the greatest direction to go when it comes to full arch. I like the idea of a higher quality and keeping the cost to where it makes sense to do a more complex case on, more complex patients and that have more complex problems down the road.
So focusing on harder treatment that probably other dentists maybe kind of stay away from?
Not necessarily. It's just, unfortunately, as the procedures become more commonly done, you get your bell curve of providers like in any field, right? And unfortunately, the more of anything that's done, you start seeing more problems with it. And as where my practice comes in, at least the practices I have in Arizona and the one I work out of in Austin, Texas, we do get to see a lot of complications that we have to end up doing a lot of total redos a lot of the time. And that's becoming more and more prevalent in my practice. And I don't want to have to grow practice that way, but that seems to be where I'm kind of falling in.
Hey, sorry to interrupt the show, but I want to make sure that you're going to DICOMA 2024. It's July 10th through the 12th. And guess what? We are going to be speaking on the main stage, and we're going to be hosting a boot camp as well. And we want to give away some free tickets. So how do you win these free tickets? You go to smcnational.com, click the little bar that says enter to win free tickets to DICOMA, and then you submit your information, and everybody's a winner. We're going to be giving a discount to everybody who enters, and we're going to be giving away some free tickets to the conference itself and to the boot camp. Make sure you sign up for these right away. Back to the show. So somebody already went and paid $15,000 to $25,000, and now a couple years later, they're coming back to spend another $15,000 to $25,000 to get the full arch redone. Am I hearing you correctly?
Yeah. So what and that's a good way to put it is anything can last a couple of years when it comes to an implant. We can make a lot of failing implants still hang on and they'll still be difficult to take out, but that doesn't make it a success. And down the road, once they start having actual pain or, things like that, and then they end up seeing a second opinion, and yeah, you end up having to do it all over again. And that's unfortunate. And, a lot of these places, I think, churn and burn these patients. And they end up having, on the restorative side too, not just on the surgery side, but on the restorative side, when you make anything cheaper, there's something that comes with it, or your margin goes down. And for me, I'm a full scope oral surgeon. I do plenty of other procedures other than full arch. I happen to do a good amount of full arch, and more and more that is becoming handling complications. And what I'm seeing a lot is, on the restorative side, when you start cutting corners on materials, or maybe they're not having prosthetic principles being followed when they're doing the surgery, and the restorative process isn't necessarily overseen as much as it should be by a restoring doctor, then you end up having some more problems down the road after, again, a couple of years. So it could be, you could look like a hero for a little bit, and then, yeah.
Yeah, so that's a big problem. And so you're actually not the first person to tell me this. So I've actually had other podcasts that I've done where they said my whole business is getting redos. That's like 80% of my business. And it's that's unfortunate, right? So we could take this conversation a couple different ways, but I'm going to take an attempt at this. If a new dentist is coming in and they're starting to do full arch, how can they prevent this from happening? Or is this just an unnecessary part of the process of learning, unfortunately?
So everyone makes mistakes. I have failures, right? I'm not immune to a failure. And the important thing is being able to, one, manage the failure, and then two, learn from it, but also remember that you are still treating a human being. So we have to do the best we can to keep the quality high and make sure your training is ready for the appropriate difficulty level of the case that you're doing. I teach plenty of difficult, implant surgery type things. So I'm a remote anchorage instructor. I teach zygomatic implants, pterygoids, transnasals, and
so all the hard stuff.
Right. And there are definitely people that maybe jump into doing more complex cases when they need maybe a little bit more training, a little bit more mentorship before maybe just jumping into things like that. And it's also just, people are getting older, they're getting sicker. People are on more and more medications these days, and that makes them not have the best bone density. And that will also create a lot of long-term issues as these patients do get younger and younger, which means you're almost expecting a redo in their lifetime. So you want to maximize.
So people are getting, I'm just going to explain this in a simple way that I understand. Yeah. So patients are doing this kind of service younger and younger, and the full arch is not made to last you 75 years.
Nothing in the body. Yeah. I mean, you get a joint replacement and they're not going to guarantee that thing for life, let alone in the mouth, which is going to absorb way more of a load, a repeated load. Yeah. And it's a very bacterial contaminated area, and they lost their teeth for a reason in the first place. So you can't, nothing can be guaranteed. And so it's also just planning for the future and being able to fix even just my own work. I mean, my youngest patient that I've done this on is in the early 20s. And I tell them, like, you're going to be seeing me again or someone else to redo this. I want this to last longer than you, but there's no way I can guarantee it. Yeah.
So somebody listening to this, if a doctor's like, okay, I want to get into full arch, or I'm just getting into full arch, what are some things that they can do that way they can avoid these problems, right? Like you said, everybody fails. So that's a good starting place. But also, like you said, we're dealing with humans, and, I do dental marketing. So if I tell my team all the time, guys, we're going to make mistakes. We're going to make errors. If we mess up, it's like someone might get a little bit upset, but it's not someone's overall health. Like, the work you're doing is far more complicated and has way bigger consequences. So what can they do to actually to not have to worry about that, or to worry about it, so that way those kind of things don't happen?
Yeah. So I think the proper continuum of any surgery. Obviously, I come from a residency background, and telling everyone to do a 4-year residency isn't realistic just to do implants. But if you're going to start learning more complex things, it's just take the time and do the education right. A lot of people tend to be self-taught these days with the internet. So I would advise against making the entirety of your training based off of what you can research online, and also find good mentors. Especially when it comes to All on X, there's just so many people that do the surgery that don't even know how to do the pros. And I'm an oral surgeon, and we get that flack a lot. And what made me do a lot more of this and also get really good at this and have a pretty good referral base for this is I really keep the pros in mind. I had to learn a lot of prosthetic stuff. And so all the surgical specialty people, I highly recommend you do that. But there are a lot of general dentists that learn this stuff that still don't know how to restore and do basic dentures even. I've noticed that the art of just doing a denture has kind of gone away in dentistry, and you need those principles to be able to do fixed full arch. So and then learning it is one thing, doing it is another thing, but then it's just learning the medicine behind it. How to manage the anesthesia is completely different, along with your prosthetics. And then if you get into trouble, you need someone that can help you. So these days I've noticed that people want to isolate themselves in an island and never have to talk to someone and admit failure and things like that. And the internet can be blamed for that too. I think when you start getting in places where you're having a lot of trouble, you need to have someone that'll have your back. And so I always encourage people to build relationships with people around them that, be able to run to them to help you and bail you out. And
how do you find a good mentor? Because here's the problem that we run into. Everybody and their mom right now is trying to start an implant course and teach people how to do implant. Like I look at all of them and I'm like, dude, there's so many of these guys. And I can tell I'm not clinical at all, but I can tell some are better than others, right? Like there's some people out there that maybe shouldn't be teaching these courses. So how would you find the right mentor? Just give me like 3 easy things to be able to identify that.
You could probably have a whole other podcast just for that. That's hard to tell. I mean, it's not like we post our CVs and it's not like anyone's 100% honest, and people never like to show their failures.
Yeah.
One of my biggest, what helped, I guess, when people started coming to my stuff was I'm really big on teaching complications. I will show my own complications. I showed my first failed zygomatic implant, and I showed how to handle it, and that was it. I mean, it's a hit to the pride a little bit, but the thing is, like, everyone learns from failure. And if you are dishonest about your success rates and your failures as well, then no one's going to learn from it, especially if you're an instructor. I'm not saying every instructor has to just show like, hey, this is my screw up. Like what,
But I think that would be really good marketing. Like if I was just thinking as you were saying that, like if I had an implant course and I was like, hey, I've done 1,000 implants and X amount of them have failed, and I'm going to show you every single failure that I've ever had and how we had to fix it. And I'm going to set you up in a position not to have as many failures as I've had. I think that would be very intriguing.
Yeah. So, I do a lot of live courses too. And I've noticed that I am terrible at picking straightforward cases for my live surgery courses. So, but because of that, I have a lot of attendees that say, I learned way more watching you work through that difficult case, or redirecting this pterygoid, or redirecting the zygomatic implant, whatever, than if you had just buzzed right through it and just made it look easy, right? I think that maybe a little bit of transparency in terms of like the instructor would be nice, but again, that's all. Everyone wants to market themselves. Everyone makes a little. I think the business of instructing dental implants has gotten to a point where it's very lucrative to do that.
It's more lucrative than the implants. People
that's what I'm saying.
Yeah,
I do it on the side as something that I enjoy doing. That's part of the residency thing that I miss doing, is teaching residents and things. So this was my way of doing it without being a part of a residency program. And for me, like, I'd rather just do the surgery myself. But if I have to teach it, I just enjoy doing it. And I just want to see people be successful and treat the patient right.
Yeah.
And not have to be a part of a complications lecture or something,
That's awesome, man. If someone wants to reach out to you and kind of learn more about you and what you do and just maybe learn from you, what's the best way to connect with you?
My Instagram is public. It's at AlexNguyen at Alex Nguyen and OMFS. So Alex Nguyen OMFS.
That's awesome, man. I really, really appreciate you coming on. And just so everybody knows, and I say this often on my podcast, but there was no financial upside or anything that Dr. Alex has anything to sell. He just said, yeah, I'll come on and talk to you about full arch. So I really, really appreciate docs like you, because we get an honest perspective. And if doctors like you don't speak up, then we only get the guys that are selling stuff. And some of them might be good, but some of them are not good too, right? So I love hearing honest perspectives and just people who take the time to educate us. So thank you so much for coming on today.
Oh, you're welcome. And I don't want to sound like I'm being too negative either.
No, not at all.
Yeah, I just
you're not being negative at all.
I don't know how we got down this route. I was hoping to talk about like growing a full arch practice as an oral surgeon, but
I think
we
this
went
is
down that route.
Well, let's do this, Dr. Alex. I will bring you back on and we can talk about growing your office as an oral surgeon. How's that sound?
Oh yeah, I'd be happy to if you'd have me back. Yeah,
yes.
That's maybe make it less bleak.
Yes, we'll make it less bleak. But I promise you, I learned a lot from this. So I know the doctors that are out there thinking about what they're going to do next and thinking about getting into full arch or trying to grow the full arch, this is going to provide a ton of value. So thank you so much for being honest and transparent.
You're welcome. Thank you for having me on, Gary.